Maybe you could tell us why you think we should obey another lockdown if it comes, why restrictions, for example, mandatory face masks as well, or working from home, why do you think that it's important that we obey those restrictions? What do you think? Tell us.
Well, look, obviously there are lots of different kinds of restrictions that could come in, and you've said how some of them could be more serious, some could be less so. The point is that whatever comes in, it's going to be a way for me and you and the people listening to this to protect, our neighbours, our loved ones, the person you see in the street whose name you're never going to know. We've all got a responsibility towards each other. It is incredibly frustrating that the government has not prepared better for this moment so that none of this was necessary, because that would have been possible. It didn't have to be this way. But we have the rubbish government that we've got. And they have brought us to this place. And we now, I think, have a responsibility, not because the government tells us to, but because we've got a responsibility towards each other to protect each other.
But
and doing things like wearing face masks and being careful.
You're still
Sorry, you go on.
Sorry to interrupt you, Richard. I mean, it's still the government telling you what to do. It's still the government bringing in restrictions that have been lifted previously, and if they bring them back in again, I mean, that's you're saying, you believe the government's not doing a good job, and you say it's for other people, but you're still essentially doing what you're told, aren't you?
Well, I'm saying that actually I think people could be a little bit more careful now, even though they're not being told to do so.
So what should people do now, even though they're not told to do things? What do you think people should be doing that they're not doing?
One thing that I'm doing is that before I go, see a family member who might be a bit vulnerable, something like that, I'm really careful about what I do for a few days before that, and I do a few lateral flows throughout that period. It's an extra little precaution. I think doing things like that just to keep the people around us safe makes sense. It's frustrating. It's really frustrating. No one wants to live like this. But, we're all grown-ups. We've got to deal with the fact that there is a deadly virus going around.
Okay, Alan Miller, there's a deadly virus. We've got to protect people. We've got to take responsibility towards other people. What's your view on this?
Well, let's break it down a little bit. Firstly, we've got a situation where 90% have had their first jab. We've got 93 to 96% immunity according to the ONS and PHE. Chris Whitty said we should be living with this like the flu now. We're in a situation where things have been controlled. We're in a very different situation now. Because we're mass testing, we may be getting results of cases in inverted commas, but primarily they're very much younger people. It's a very lower risk. They're not resulting in people who are going in hospitals. And the pressure on the NHS, which happens every winter over the last 15 years, is not a reason for us to have impositions again. Actually, one of the reasons the NHS is under so much pressure, and we've got so many issues with the economy, loss of jobs, livelihoods, health impacts, is because of lockdowns, is because of the policy of restrictions. And it's absolutely outrageous to threaten us with further impositions and restrictions, taking away our liberties and our freedoms and our rights for something that actually has created this. This is not how we now move on with something, dealing it with like the flu. We do not and should never have to exchange our freedom to address this. What we need to do, and the government should have done, is prepared things from a health point of view. And the way we get out and get into recovery is to ensure that the economy is open, that we engage properly, dynamically. That's how we pay for the NHS. And the whole idea that we suspend our rights, our hard-won rights, that we are the custodians and the beneficiaries of, is absolutely wrong. That's why we sort of encourage people to sign the Together Declaration.org, which is saying that we don't want to have any vaccine passports and any of these other impositions. The policy of lockdown has absolutely been enormously damaging. And we also know that whilst they talk about that and then say, well, we don't want lockdowns, but we want you to have Christmas, and we don't want social distancing and mask wearing and vaccine passports. These are all huge nudges. It's blackmail, it's threats, it's abusive. And
okay,
actually,
let's hear what Richard has to say. We've heard quite a lot from you, Alan, so I just want to bring Richard in again. It's blackmail, it's abuse, and it's threats. What do you think of that, Richard?
I think, Alan, I really respect anybody who wants to protect our civil liberties. I think we should all be really conscious of the ways the pandemic and the restrictions related to it have undermined those. And I think that when this is all over, before this is all over, we should be expecting Parliament to look into, next time something like this happens, because it will happen, something like this, how can we be sure that that when the government takes away our civil liberties, they can only do it for a very, very specific controlled period of time, that kind of thing. But I think some of the things that Alan said were, either just not right, or I think, kind of leading people in the wrong direction in terms of accuracy.
Okay, just briefly, what's the key point on that? Because I want to bring Alan back in.
Okay, yeah, absolutely. So, in terms of saying that there's lots of people who've been vaccinated, yes, but we know that there's, that there are new strains of the virus that have come in. So actually, there isn't nearly as high a level of immunity as we would want there to be, as high a level of immunity as we thought there was going to be. You talked about the fact that there aren't high levels of hospitalizations yet. Yes, but we know that high numbers of cases are going to result in hospitalizations. The NHS is telling us that.
Let's just get the final. We're just running out of time. I'm sorry to cut you off, Richard. Alan, let's get the final word from you and what you've heard and what you think about this.
We know that masks are primarily a pantomime. We've been told that they were used by psychologists on stage to help us feel safe. We know that in Sweden and Scandinavia, they've dispensed with these things and they don't have high rates, but where we see in Wales and other places like California, where they've continued it, in Australia with lockdowns, they've been terrible and the cases have increased. We know that Florida has not had these MPIs and that they're doing very well. And what we need to do is have honesty now. We need to open up. We need to be open for. People should sign the Together Declaration.org that challenges the idea of unscientific vaccine passports. They're nothing to do with health and everything to do with a show me your paper society. It's outrageous that we're even having this discussion now. People should stand together, have their voices heard and challenge it. That's why we say people sign the Together Declaration.org. Write a letter to your MP. Do not agree with it. This is absolutely unnecessary and we should all challenge it.